Developed by the Federal Ministry of Women Affairs and Social Development in collaboration with partners including WaterAid Nigeria and Population Services International, the policy seeks to address high costs of sanitary products, poor access to water and sanitation facilities, limited menstrual education, and the stigma surrounding menstruation.
When you look at education, the issue of education has to do with what curriculum do we have? There are no single document that says this is a curriculum on menstrual health hygiene. So we looked at all of those, we did desk reviews, and then after we did all of these consultations, including the private sector, because the issue of access is very critical, we looked at corporate social responsibilities of the business community.
It also highlights the needs of women with disabilities, those in correctional centers, and patients in psychiatric facilities, groups often excluded from public health planning. Now central to the draft is the enforcement of presidential tax waivers on sanitary towels under the new Tax Reform Act.
On behalf of all Nigerian women and girls, extend my profound appreciation to His Excellency President Bola Ahmed Tinubu, GCFR, for his visionary leadership and deep sensitivity to gender and public health matters. His recent approval of tax waivers on sanitary products in line with the newly signed Tax Reform Act is a landmark intervention.
Officials say that ensuring these exemptions are implemented will lower prices and improve access for millions of women and girls across Nigeria. Development partners welcomed the draft, noting that only 11% of Nigerian schools currently have wash facilities. They pledged support for robust implementation once the policy is finalized, calling it a transformative step for education, dignity, and health.
Knowing the absenteeism rates over 20% in schools for girls, it's so important that we get this policy out and we get real action on menstrual hygiene so that no girl misses out on her education as a result of that.
To complement the rollout, the FCT Women Affairs Secretariat donated 10,000 sanitary pads for distribution across all 36 states.
It is precisely in this context that the validation of a robust and comprehensive national policy on MHHM becomes transformative by addressing not just the access to menstrual products, but also essential infrastructure, including clean water, sanitation facilities, waste disposal systems, and hygiene education.
If fully implemented, this policy will redefine menstrual health as a matter of rights, not privilege, for all women and girls in Nigeria. Somi Maduagu, Arise News.